schools are pausing the district's reopening plan now that the positive test rate for COVID is at 4.1% in the city. And to discuss that with us now is Dr. Daniel Korytskis, chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Good to see you.
Good evening, Emily.
So let's talk about this from a public health perspective. Why is 4%? Why is that an important threshold?
You know, it's not just the 4%, but it's also the fact that now in Boston, the rate of COVID is about 8 per 100,000, which puts us into the red zone. And I think it's important for everybody to pause and take a step back and reevaluate why we're having these many infections and make sure all the right procedures are in place before continuing to move forward.
Kind of reassess. And that's what our sports teams are doing too. Stephon Gilmore of the Patriots has now tested positive for COVID-19. Two other players have. The team canceled practice today, but they're scheduled to play Denver this Sunday. It's at Gillette. What is the risk? And does it matter that they traveled together this past weekend on those two planes to Kansas City?
I think that travel is potentially concerning, especially if people may have been taking off their masks while on the airplane, even though air travel generally has not been a huge concern. I'd be concerned that people be certain to get retested before the game to make sure that nobody else has turned positive who might not have been diagnosed the first time around.
Right. All right, let's shift gears and talk about the president. Today, his personal physician says samples taken on Monday show detectable levels of COVID-19 antibodies. What exactly does that mean?
It doesn't mean very much because the president got a large dose of the monoclonal antibodies on Friday, and I would expect that he's going to be antibody positive from those infusions for several weeks, and it doesn't really tell us whether he's making his own antibodies.
So the physician also said today, following up on this, that the labs showed no antibodies when he was initially tested last Thursday. Does that give us any clues about when he may have become infected?
It gives us a little bit of a clue. I mean, you can take about a week or so to develop antibody reactivity. And the fact that he was negative on Thursday only tells us that he had to have been exposed sometime within 5 to 7 days of Thursday.
All right, so pretty big window. Okay. Dr. Korytskis, thank you for your time and your insight. We really always appreciate it.
You're very welcome.
It's always